Welcome to the webinar today, tricks and tips for landmarking. Now, this is the next challenge. Why won't you? Here we go. Yeah, so just a little bit about my background. So I've been a vet for 14 years, but really my journey into the sheep industry probably kicked off. I was the managing partner of Western Rivers Vets based out of Warren and Nyngan. And about 5 years ago, I was looking around and thought we're in such a big sheep area, but as a private vet, we didn't really do a lot of proactive sheep work. And by that, I mean providing services that would drive the profitability and production of our clients. So we got into sheep scanning, and that was fantastic, but it kind of was like one of those things where you make a clean spot on a table. We had to keep going, and then we went into lifetime ewe, and then we went into looking at lamb survivability and doing workshops. And I kind of looked around and I thought, the dairy industry has got so many advisors and specialised vets, and the feedlot industry has advisors and specialised vets, and Gay Waterhouse doesn't get, the local vet in to come to her stable. But when you looked around the sheep industry, particularly in, Central New South Wales, we didn't have a whole lot of specialised sheep vets who were really trying to drive production and profitability as opposed to being more reactionary and trying to sort out the fires once they'd started. So really today, everyone, my aim is I really want to try and be a bit of a conduit between science and I suppose where the rubber meets the road in your environment. There were 3 parts to today's webinar. Firstly, I'm going to cover some animal health issues. The second one will be I'm going to run through what weapons we have to fight pain. And thirdly, it'll be how it's not all about the lambs. And we just have a few formatting problems there, but anyway, we're just going to press on. So I suppose anyone familiar with Stephen Covey and the 7 habits of highly effective people know that his definition of a principle is something that is either unchanging or universally true. And when we looked at the AWI Best Landmarking Procedures Guide, that they illustrate in the first couple of pages that the principles of landmarking are to maximise hygiene, minimise stress on the sheep, and maximise recovery rate. Now, I've kind of come up over my brief career as a vet that I've got my own little principle, and that is all country vets want to be farmers, and all farmers think they're vet. And I reckon I've come up this after working, a couple of states in Australia and the United Kingdom. So if we go from that, then we go, well, marking lambs is creating a surgical wound. Therefore, everyone who does lamb marking is a sheep surgeon. And that's the way I want to frame up today's discussion, is that everyone who's listening today, or at least 54% of the producers listening today, everyone's going to be a sheep surgeon, and we need to think of that. That's our mindset. We're providing surgery. So what are the principles of being a surgeon? Well, we're precise with our surgery. We're clean. We want to maximise our hygiene to prevent any infections. We want to minimise any pain or discomfort for our patients, and we want to maximise patient health and recovery. And if we go back to our best practice guys, that's exactly what we're talking about here with hygiene, minimising stress and maximising recovery. So, conducting surgery, timing is important. And once the best practice for doing landmarking is between the ages of 2 to 8 weeks. Why is that so important? Is because as surgeons, it's all about the wound and the stress we're going to cause. So any younger than 2 weeks, and we're going to give them too much of a setback. Any older than 8 weeks, we're going to get ourselves, a bigger wound, more complications, and just physically on an OH&A sense, it's just harder to lift bigger animals. Now the conditions. Now as sheep surgeons, we have to do surgery in the hardest operating theatre in the world, out in the paddock. And so the conditions, we have to be careful. It's not too hot and not too wet, because if it's too wet, then we run the trouble of increasing, chance of arthritis. Also, we just need to be mindful of, when our biggest fly problems are during the year. We also have to be mindful of conducting surgery when our animals are growing and in the best health possible, but also we have to be mindful that we need our patients to have at least 4 weeks of recovery time. So all surgery has complications, and some of the big risk factors for us is arthritis associated with marking. So we know the risk factors for arthritis with marking is associated with mulesing, marking. Shearing also is a high risk for arthritis, and tail docking. So I try to break this down into the 2 main types of post, I suppose, husbandry procedure arthritis. And I try to, and for probably a few vets online, hopefully you don't judge me too hard, but I just decided to make it super easy. We've got bugs that cause pus and bugs that don't cause pus, which causes fibrin arthritis. So now, why that's important is that gives us, knowing what's happening if we have an arthritis problem, gives us an opportunity to put something in place to try and minimise it in the future. So how we diagnose this is that if we have a problem, then the best thing to do is to seek some vet advice and get someone, a veterinarian, to have a look at these lambs and to start taking some samples. Because if we work out that it's erysipelas, the opportunity there is that we have an intervention called Erivac, which is a vaccination that we can implement to minimise that chance. The other side of that is that if we decided to vaccinate without a diagnosis, then we really run the risk of, allocating resources to something that might not give us our best return on investment. So a few people will ask, well, Tim, we've got, maybe a tail wound, a castration wound. Why do we get arthritis in the joints? And really, it's all about the way bacteria can spread in the body, and it does that by the bloodstream. So, we can get a wound that happens, say, at the tail, and it can travel all the way through the body in the bloodstream and set up camp in the joints. But why the joints? Now, we know that that joints, the immune system really struggles with infections in the joints and infections in the bone. And any of the producers out there who are dealing with foot abscesses in their rams will know how hard it is to, really attack those problems and get good results. I've actually got a vet mate in Queensland who stabbed himself in the knee with a bang pow knife. He ended up getting an infected joint, and when he was in hospital, they flushed 20 litres of fluid through his knee joint to clean it out, because it's such a hard place to manage with an infection. So imagine you're a little lamb. Now you've got bacteria kicking around in your bloodstream, but also you've got your immune system's copping a bit of a blow because you've had the shock of being marked, and that's why we just see so many problems with arthritis in the joints. So the other bug that we worry about, really, as surgeons doing field surgery for husbandry procedures, is tetanus. And tetanus is part of the Clostridial family, which is really what we vaccinate for in our 5-in-1s or 6-in-1s. There is a few others that can cause dramas, but really tetanus is the one that we worry about the most. And basically, tetanus is a bug. It lives in the ground, it lives in the dirt, the soil, and it loves wounds, particularly old ones. So we see problems with tetanus in our lambs when we've got unvaccinated flocks, completely unvaccinated flocks. We're using dodgy rings that don't really constrict that wound well enough when we're using rings. And when we're putting rings on tails and scrotums that are just really too big to constrict the blood supply properly. So basically, how do we attack that, and how do we, particularly for, say, tetanus, what can we do about that? Well, the good news is that we can vaccinate, and it's really effective. The challenge for vaccine is that, in my mind, vaccination is just like shoes. Yeah, one's better than none, but if you want to go anywhere, you really need 2 shoes. And our vaccination protocol for lambs is that, first of all, can we give them any kind of protection from mum? And the answer is yes, we can. And what we see is that if we vaccinate mum 4 weeks before lambing, as you can see in that number 1 there, if we can vaccinate her 4 weeks before lambing, she'll develop immunities, because remember, that's what happens when we vaccinate. We develop immunity and antibodies on how to fight the bugs. Then she will pass on to her immunity or some of her antibodies. She'll give that to her lamb during the colostrum. And the great news is that can provide up to 8 weeks protection. So remember, if we talked about the best practice is to vaccinate between 2 and 8 weeks, then we know that those lambs in that 8-week period will have some protection from mum. Now, as you can see there, when we vaccinate at lamb marking, they get a little bit of protection, but we don't get a lot. And so we really need a second booster vaccination to really, as you can see that green line going right up once we give that booster. So we really need to give that booster vaccine to give that great kind of protection. And in that spot where it says 3 is that's the spot at weaning, when we're going to start really need to look to protect our weaners against pulpy kidney. And that's what our clostridial vaccines or our 5-in-1s do. I've just left a little note there. Remember to use 1/4-inch needles for our vaccination. Now, Sheep Connect put a post up earlier on in the week going, well, what does cancers, arthritis, and rectal prolapse have in common? And the answer is tail length. So we know that if we have the right size tail, then a ewes can still, or a sheep, they can still lift their tail. They can help channel urine and feces away from the breech area, and that little wiggle they have, 1, reduces all that contamination, but 2, helps reduce fly activity. So really having an accurate tail length helps reduce fly strike. Secondly, by docking tails at between 3 and 4 joints, we provide cover to the bare areas and we protect from sun damage and skin cancers. Thirdly, it reduces the chances of rectal prolapse, and we have seen that so much in the last couple of years for people who are feedlotting lambs, that they really need that tail to kind of keep the muscle tone tight. And a final reason is that, remember, with surgeons, the smaller wound, the reduced chance of infection and shorter healing times. So, sheep surgeons, the 2 main principles are, when we're conducting surgery, the smaller the wound, the better, and the cleaner the wound, the better. So the next question is, well, how do we get the best out of our surgery? And first of all, we've got to make sure that when our patients leave the cradle, they're landing on their feet. Remember, what we're trying to do is minimize wound contamination, because the more contamination there is, the more chance we've got bacteria going into that bloodstream, and the more chance we'll get some kind of arthritis issue. Now, cleanliness is next to godliness, and that's, again, we're surgeons and we know that's a principle. So we've got to keep all our instruments as clean as possible, no dirt, no feces, and reduce as much blood on our instruments as much as possible. If anyone's ever had been to the doctor or had a really bad infection and got a swab taken for culture, and anyone who's had bad orthopedic complications will know this, that we send a culture away to the lab to grow what kind of bug we're dealing with. How they grow that is on what we call a blood agar plate. So it's just a little plate, it's literally blood, because blood's got so many nutrients in it that grows bacteria, sorry. So what we know is that we've got a contaminated wound, and if we've got a lot of blood hanging around, then we've got a great little substrate or a great little environment for bacteria. So we want to minimize that as much as possible. Now, I've put this in there, the 10-second rule doesn't count. For surgeons, you imagine if you were getting a skin cancer taking off and your surgeon dropped the scalpel and came back, picked it up off the ground and came out, how would you feel? The 10-second rule doesn't count for surgery, so we want to be as clean as possible because we want to protect our patients from things like arthritis. I suppose the next to get best out of our surgery is getting our lambs back on their feet ASAP and back with their mums. Next, well, with surgeons, we've got to use the right gear the right way. So that's proper vaccine use, putting them in the right spot under the armpit will give us, can give us inflammation and lameness. So we want to avoid that. Changing needles regularly. If it's not sharp and you've got to put a bit of pressure in under the skin, then you definitely time to change a needle. And as surgeons, doesn't matter if you're using a cold knife or a hot knife, everything's got to be hot and sharp. Remember, principle of surgery is we want to be precise with surgeons. And finally is just make sure that we check our calibration of our instruments. Sometimes our little vaccinator guns can get a little bit out of whack. So tricks and tips, that was part of the topic. And I just thought when we've got lambs in the cradle, we can spot a couple of those weird and wonderful things, and identifying the one nutters is a really good thing. And I've just got something here. This is from Matt Playford from Doorbus, and just putting little zip ties on that tag so at weaning we can identify these guys. The one nutters or the cryptorchids are so pesky, and with a lot of people joining ewe lambs, like we all as vets, you always get a phone call going, oh, I've got this stag started to ride my ewe lambs, and it's a real problem because even though one of those testicles is in the abdomen, he can still fire some shots in anger. So we want to identify these animals and make sure we keep them away from our ewe lambs. The other trick or tip I like is, and I've just been playing with this, is I kind of trying to think of ways that how do we make vaccine or drug delivery easier, and that's just a bottleless, I suppose, vaccinator gun. And I've just got it here if you can see it on the camera, and it really is, you draw it up from your vaccine bottle or maybe like your Metacam bottle, and actually it's set here, and all we do is we can just inject it. So your vaccine bottle can live in your esky, and then we can just keep it safe away from sun, away from the heat, and you can just draw up and go down the race and just inject like that. Anyway, just something, just a little bit different if you're having trouble, with a vaccinator gun attached to a bottle, and that makes life easier for you. So guys, as surgeons, we know that we're creating a wound, and we know that creates discomfort and pain for our patients. So what are we actually dealing with? The first part of, I suppose, the signs of pain is that in the first hour we have the fast pain, and basically that's our body's insult detection mechanism. So how this would work is that if I go touch a hot plate and I burn myself, straight away I get a signal from my finger to my brain saying something very bad is going on down there, move your hand. And so this happens, and this style of pain is straight, like almost like a phone connection, happens within the first hour. Now, after that, and anyone who's burnt their hand on a hot plate knows that after that, you get that throbbing pain, and that really starts kicking in after a little while, and generally, within an hour. And this slow pain is actually the tissue's response to the damage that's incurred, or a surgical wound in the case of landmarking. And this is, I suppose, a throbbing feeling as the damaged tissues release all kinds of chemicals that kind of kick off the body's, I suppose, fire engine, the reactionary to get in there and start repairing things and get the immune system kicking on. So I'm a big believer in control what we can control. And as surgeons, well, can we control this? And the answer is yes. And we've got two real places to control this, and that's anesthesia, which is looking at how do we control the acute pain or the fast pain phase, and analgesia, how do we control that chronic or the slower pain phase. And I kind of use that A&A for short. But basically, what's the difference between these two kind of ways we can attack and deal with pain? And firstly is, the anesthesia is basically dealing with the sensory and the phone kind of transport, or the I suppose the message that's getting sent from the site of inflammation. So we've all probably had some local anesthetic, and we know what it basically does is that it just kind of knocks out that signal. The pros of that is that it works really well at knocking out the signal. The cons of that is that it only really works for about an hour. And anyone who's been to the dentist and had the local block knows that feeling. You can't really feel it at the time, but geez, afterwards you can. And that's when the slow pain comes on. And that's why when you're at the dentist, you get a local block, but then also you'll get your Nurofen to help with that kind of pain for the 1 hour plus. But to set the expectation, what we're trying to do as surgeons is minimize the discomfort. I don't think there's going to be, you can't go to a dentist, and I don't know, short of being knocked out, I don't think there's any solutions that will completely remove it. But the idea is that as surgeons, we're trying to mitigate that as best as we can. What we do know is that using that combination of that anesthesia and analgesia is that we can provide the best solution possible. And that's what your dentist does with the local anesthetic, but also the Nurofen when you go home. So what are the effects of pain? And the first one's behaviour, and I think that goes without saying. So the benefits of using A&A would be, for us as surgeons doing lamb surgery, is to reduce that discomfort behaviour. The benefits are this will make it easier to move lambs post-marking, but also we'll get better ability to mother up, and we'll get less that lying down behaviour, which means less dirt, less contamination on our wound. And we know that if we can reduce the amount of wound contamination, then we're going to reduce the chance of, getting any complications like arthritis. The next one is the hematological system, which is basically the immune system. And we know that when we have insults or when we do surgery, that we really see impact on our white blood cells. Now, we need our white blood cells because they're our soldiers of the immune system. So we need them to be attacking any kind of trouble that happens with the wound. So one of the benefits of treating pain in our lamb marking is that we have reduced stress on the immune system, which means they're better at fighting the baddies. The next one is our physiological sides of pain. And basically that is that we know that the procedures will cause stress on the body beyond the 24-hour period. And so we need to make sure that we provide a buffer to that. So often I think of, for the physiological side, is that, well, if we looked at the last couple of years of drought, we've had these, really, our little lambs have been doing it really tough in tough situations. And I imagine that's like a, little 18-year-old footy player kicking around for the Bogan Bulls, running up against the All Black backline. They're going to get absolutely smashed. So we've got to do everything we can to buffer them from that challenge and help them. And that's how anesthesics and analgesia really helps, is that it decreases that physiological stress and helps them deal with that setback as best we can. And then finally, what's the, I suppose, societal impacts of pain? And we know that marking and mulesing procedures can cause some negative emotional responses from either our consumers, ourselves, or even our non-consumers. So on a society level or as an industry level, there is some benefits by using anesthetics and analgesia, because that helps manage our expectations and our needs of our customers, our non-consumer concerns, and I suppose really trying to buffer that, and we can show all of the stakeholders that, hey, we're doing everything we possibly can to mitigate your concerns. Maintaining market access through welfare programs, and basically the benefits of using anesthesia and analgesia is just, it makes us feel good, because we're doing the best we can as surgeons to take care of our patients' needs. A question I've been asked a couple of times this week is that, well, I'm not mulesing, do I still need to use pain relief? And I suppose when I put it through the filter of the different ways pain works, then I would say, well, we do see responses of behaviour for tail docking and castration. So then my answer would be, yes, we should be using anaesthesia and analgesia in all these surgical procedures, because remember, we're surgeons, and we've got to make sure our patients are we minimise the discomfort as much as we can. After using anaesthesia and analgesic products for several years now, I suppose field experience tells me that no client that I've ever used these products with has ever gone back after using them. Everyone has been happy. So, well, what are our weapons as sheep surgeons, in the fight against these aspects of pain? AWI has done a massive, with CSIRO, did a massive literature review on this, looking at thousands and thousands of articles about, well, what are the best options? And basically we've come up, with across the world that the best options are local anaesthetic, or anesthesia, and then analgesic product, which is moxicom, which is one type of an anti-inflammatory, which is kind of like Nurofen. So, it's really interesting, this whole space. And, if you look at the human aspect, we don't even know everything about human pain and how pain works in humans. So it's just such a, I suppose a lot of research has got to come through yet. But so as surgeons, well, what's our armory? Like, what are we dealing with? What our weapons are to take on, these aspects of pain? And then, like I said before, we've got two real groups. We've got the anesthetics and the analgesics. And they're basically, we've got two products that are commercially available in both areas. One's in the anesthetics, we've got numb nuts and trisulfan. And in the analgesics, we've got Metacam and buckalgesic. And I'm just going to run you through these ones briefly now. So numb nuts, this is our first one in the anesthetic agent. Remember, so this is blocking the signal. It's very fast acting. The duration, like I said before, the cons of this is that it generally only lasts an hour, but it's very targeted at desensitizing the location of our surgery. And we use it basically whenever we use rings, either during castration or tail docking. So this is basically how it works. And you can see the orange dots on my little Larry the lamb there shows the two surgical places that we would use this. And you can see in this diagram here that the ring, I suppose, constricts the blood supply to the scrotum, but the local anaesthetic, which gets injected by the numb nuts mechanism, blocks the signal. So you imagine that's like putting mute on your phone. There's no signal can get through, or very little signal, and so that's how this local anaesthetic works. Trisulfan, that's our other anaesthetic agent. So that's very fast acting. It's a spray on. Its duration is 6 hours, but in some animals, and the good thing about anaesthetics is sometimes, because we've turned a mute on the phone, that we get prolonged a desensitizer or decreased wound sensitivity using those products. So 6 hours, but it can be certainly longer in some animals. Again, it's targeted, it desensitizes the location. Trisulfan has got 4 ingredients. We've got lignocaine and bupivacaine, which are 2 local anesthetics. Why 2? Because the bupivacaine lasts a lot longer. So we're trying to provide maximum, I suppose, desensitization, because that's what anesthetics do, to our patients. It's got adrenaline, and what adrenaline does is that it reduces the constriction of your blood vessels. So we reduce the amount of blood, but also by reducing blood supply, we can increase the amount of time those anesthetic agents stay on our site. And the third part is the cetridine. So that's the antiseptic part of the product. You can see here on my little drawing of Larry the lamb, we sprayed onto the site. So that's castration, mule site, and the tail docking. And you can see how it's sprayed there in my second diagram. So now we're moving on to analgesics. So remember, this is like sheep Nurofen. The first one is buckalgesic. Now, we can use buckalgesic for all our animal husbandry procedures at the marking cradle. The delivery style is quite novel in the fact that it's given orally, but it's got to be given in the gums. It's kind of like a gel or maybe a kind of bit of a runnier toothpaste. It takes about 10 to 15 minutes to kick in. Its effects is, and this is why it works very different to the anesthetics we just talked about, is it deals with the whole body. Its duration, how long it lasts, can be 24 hours or more. And in this diagram here, you can see how it here, like this is how we administer it, this gun here, and then we give it orally, and you can see in the photo on the upper right that it goes in between the gums. It's got to be absorbed in the gums. We can't drench it. It's got to be given in the gums. And then what it does is, though, it gets absorbed in the gums, but then it can go to all our sites of inflammation from our, remember, we're surgeons, so all this, for the tail dock, the mule site, the castration, the ear tag, all those sites, that one administration of it in the gums will go to all these sites. And this is a producer trial at Armatry in 2018 we did, and it was really successful. The second one in the analgesic category is Metacam. Now, Metacam is the injection under the skin. Its effects, again, it's systemic. It works in the whole body. And the onset of this is it is about 10 to 15 minutes to kick in, and its duration can be up to 72 hours. How it works is we inject it under the skin, and then it goes via the bloodstream to all our surgical sites. I suppose the other really great thing about all these analgesics, buckalgesic and Metacam, is that they can work on all sites of inflammation. So one injection can treat all our surgical sites, but also they're really good things to have on farm, you know, because anything that causes discomfort or pain or inflammation or fever can be treated by these products. So we can use it on pneumonias, foot abscesses, pink eyes. So I think as a tool, as a general farm tool to improve the welfare of our animals, I think they're great products to have on hand. So the question is, well, what weapons do I use? And my first rule is any weapon is better than no weapon in a surgeon's fight against pain. The second point is that two weapons are better than one. Remember, our dentists use local anesthetic and use Nurofen, and that gives us a best, it's called a multimodal approach, and it really gives us our best chance of mitigating all. Remember, there's a couple of different aspects of pain, and we get two products get to deliver the best outcomes for our patients. So our choice really depends on what procedures we're doing, our personal preference, and how we best want to address those different aspects of pain. And there's a lot of, as they say, combinations and permeations on how we do that, because there's a lot of different procedures. So my strong advice is have a chat to your local vet about what are the different options and how they could work out depending on whether you're mulesing, marking, and how you're doing. Is it surgical? Is it hot knife? Are you using rings? Availability, with exception of trisulfan, all the other products, buckalgesic, Metacam, and numbnuts are all available through your vet. Trisulfan is available at your resellers. And I always have the joke that, you know, the good stuff is behind the counter at the bottle shop. So I'd really encourage you to have a chat to your vet about, well, what are the options? What's best for you and your environment? And how do we really kind of get the best outcome for your patients? Mate, apart from myself, there's a lot of vets out there who love talking sheep. Your local vet, LLS vets. If you get stuck, you can email the Australian Sheep Vets at that email listed below. The Phone a Vet app might be another opportunity for you to, you know, suppose contact a sheep vet. But I suppose my thing is just, well, let's get as much information as we can, because that's when we make informed decisions. So cost, well, the cost is really about, well, you know, it's a little bit, again, what are we doing on farm? What procedures are we doing? Because we'll have different needs for different procedures. What are the sizes of our lambs, the number of our lambs, and the sex of our lambs? And so it's a little bit of a piece of string question. Now, in the December Beyond the Bale, they'll run you through all the different costs, just to give you an idea of what the costing stacks up for each different products. From there, the kind of range goes from, you know, 67 cents to a, you know, $1.88 for 15 kilos. But again, I think looking at that table and looking in that price range, I think you can get both anesthesia, analgesia combinations to give you the best care for your patients well within that price bracket. And I think have a chat to your vet and talk about, you know, all these things I said. What are you doing? How many lambs are you doing? What size the lambs and what are the sex of the lambs? And I think a lot of vets could tailor the best solution for you and try to make it cost affordable as possible. And my last part of this talk was really trying to look at, well, is there any other opportunities at lamb marking that we can take advantage of? And so in this sense, it's not just about the lambs. And wetting and drying and use is something that is so easy to do and can really make a big difference to your net reproductive rate. what that is examining the udders of those ewes and to see who's lambed and who's lost their lambs. And what we know is from a lot of the research and at the, say, Trangie Research Station is that the difference between the top 25% of your flock and the bottom 25% of your flock is that on average, the number of lambs they bring through. And so what we also know is that bad mums are repeatable bad mums. So if you think about that your reproduction rate is like compound interest, then all these bad mums in your system, your bottom 25%, well, they're just not making any deposits in the bank account. And that way is that we need to find them and vote them off the island, or, you know, at least identify them. And so now we know, well, who needs to get culled, and that can be via, you know, a black tag, an earmark. It doesn't matter how we do it, but we really want to make sure, because this is our bottom 25%. If you like a rugby analogy, these are the players who are really not making any tackles. Their tackle count is really not doing much, but they're drinking, they're eating everyone else's, you know, oranges at halftime. If you're interested in this and you haven't seen it done, YouTube Wetting and Drying Ewes, and Gordon Refshorgy from New South Wales DPI has got some great video resources on how to do that. So at lamb marking, it's also time to get the pen out. And I love the idea about debriefing. And so we should look, you know, we've got a lamb marking percentage in, and that percentage to use join is in. So we've got a pretty good idea what our scoreboard's looking like. How do we go? If so, why so? If not, why not? So what we're trying to do is go, well, if we've got a great result this year, why did we do that? And what are we going to do to make sure we keep getting a great result? We didn't get a great result. Why not? What are we looking at? You know, and that in that kind of way of assessing and mission debriefing, we can do is that, well, let's look at our paddocks. You know, let's look at the topography of where the shapes are, where's the wind coming from, the location, are they in traffic areas, predation, maybe we need to look at, you know, if we didn't get a good result, maybe we should look at pest management, or what was our nutritional background there. If we got, you know, some losses from, you know, scanning to lambing, which is different, I suppose, to use joined to marking. Well, you know, did we collect any of our lambs that didn't make it? Did we conduct any autopsies? We can get some great information from those autopsies. Did we get away and see what the lamb birth weight is? Because we know a lamb birth weight is directly related to lamb survivability, directly related to ewe body condition score at lambing. And the other one is, well, that's looking back. How do we look forward? And here is when, at lamb marking, is when we start getting ready to manage weaning. And big part of that can be planning to draft out that tail at weaning. And let's give them some little bit of extra help to help them along. Looking to the future, that can start at lamb marking with electronic tags. Now, for a merino enterprise, the cover charge to the Repro Club is all about what the ewes are doing at scanning and they're lambed and lost. You know, checking that udder at lamb marking, and it's really important to do that at lamb marking, not at weaning. Now, it's so easy to do it, and you don't have to get too complicated. Remember, you know, a little bit today's technology, keep it as simple as you can. And I think you can step into electronic tags and start getting that data, and it doesn't cost much. And all you need is a tag, the tags, you know, a stick reader, and just a service provider, just to help you with that journey. Start small. Start at this year's maidens, and kind of, I think that really starts building that little bit of information for you. And the exciting thing isn't even if you just aren't using it this year, you're building the onion, and then when we need to make future decisions, we've already got the data there and we're ready to go. For all the innovators out there who go, well, what's the future looking like? And I think a big part of that is starting to measure our maternal characteristics. So this is something called Smart Shepherd collars. It's really innovative technology, and that's where we put 2 days before marking, we put collars on our lambs, collars on our ewes, and then we can start working out, well, which lambs belong to which ewes, and then we can start looking at, well, which ewes are doing the best job, and let's start really focusing on those girls. And again, if so, why so? If not, why not? Guys, that covered a little bit of ground in a pretty rapid fashion. So, you know, I love a good pun. So for flock's sake, we're all sheep surgeons, and we've got to practice best hygiene because that's best for our patients, and that's how we minimise the setbacks and the chance of getting arthritis. Good surgeons use 1A, so anaesthetics or analgesics. Great surgeons will use both. And my last piece of that little webinar is just make every post a winner. Landmarking doesn't have to be about the lambs. You know, there's some real opportunities to start driving the reproductive performance of your flock, build your compound interest, and start really kind of looking to go forward. If you've got any questions about today, there's my email address. You know, the Facebook for flock's sake, sheep production services. And I suppose that, you know, for everyone, we're all on a learning, everyone's a lifelong learner. And if you ask them the question, well, we're at landmarking, what's next? And I'd really strongly encourage everyone to do Winning with Weaners workshop. Fiona, Sheep Connect has got this as a webinar, but also it's a workshop. And then we've got, you know, some whole lot of workshops in the suite. So speak to Sheep Connect New South Wales about what else is there out there and available to you. You know, keep learning and keep progressing. Guys, Fiona, I think that wraps it about up for me. So thank you very much for listening. And this was the maiden voyage for flock's sake. So thanks for your patience and your time.
Thanks, Tim. Fantastic presentation. Which was, sorry, my webcam's just switched itself off. We'll see if it'll come back on. There we go. Great presentation. Thanks, Tim. And I've still got time to take some questions coming through. It's not too late to type them through. But I'm going to start off with a comment that's come through, which I agree with fully. Covered the topic brilliantly, really engaging, great speaker. Can't believe we haven't heard more from you before, Tim. So there you go, bit of feedback for you. Very enjoyable and very informative.
Oh, thank you.
Okay, I'll kick off because we don't have a great deal of time left in our hour, and we'll try and stick to it for you. Tim, what are the impacts of nutrition on vaccine effectiveness?
Oh, that's a really good question. How I look at it is that if you think of nutrition, and if I thought of a growing animal, now growing animals, as we know, will have a high need for protein. Now, this is how I interpret it: is that protein makes up the bullets in the immune system machine gun. So if you've got an animal that's got that's meeting its protein requirements, that's growing, then that is in the best, I suppose, position to utilise and respond to the challenge. Because remember, vaccination is just like a training run. It's the pre-season workout or the pre-season training before we start our season. So we inject our animals with a disease that's, you know, so it won't cause any disease, but it's really like, hey, this is what it looks like. This is like, you know, your training. So when you see that disease in the real world, you know how to beat it. So certainly I think healthy animals will respond better to vaccination than an animal that's already sick or challenged.
Yeah, definitely. And all our vaccine companies always have on their packets not to vaccinate sick or poorly animals. So right on target. Next question. I tail dock using a hot knife. Can I still use trisulfan?
Good question. Trisulfan is registered for that. I suppose in that setting, if you're tail docking and you'll be castrating as well, I suppose I probably have a preference for using like that analgesics, only because that lasts longer and you get that multi-site to go on there, but certainly you can.
Tim, looking at hygienic tagging, do you recommend the use of hibitane to dip applicators or tags in and age it tagging for best retention?
Age of tagging, I'll just say when you're landmarking, because that's the most practical time. But certainly, like we talked about before, when you've got, I suppose, as surgeons, we know that you know, one of the principles is hygiene, and I think, yeah, Hibitane is really good for that. And as a general rule, you know, like that's why I say, make the joke about the 10-second rule doesn't count. I think the cleaner you can make those instruments, the minimal complications you're going to have.
Tim, another question about trisulfan. Is there a way of using it with rings, or would you recommend a different product?
Great question. No, so remember trisulfan can't be used with rings because it's an anesthetic agent and it's got to get to the phone line. So for trisulfan to work, we really need a wound. And I suppose going back to the previous listener's question about the tails, is that's sometimes the challenge with using trisulfan on the tails. Is that, you know, can we get it to the wound, particularly with a hot knife? So trisulfan, we can't use that with rings because there's not really a wound there for it to kind of activate. Can't really hit the mute button. So if you're using rings and you really wanted to use the anesthetic, then numb nuts would be the way to do it, because that way, like we said in the picture, the local anesthetic can go straight into the nerves or the phone line system and just hit mute on that.
Thanks, Tim. You spoke about the importance of 1/4-inch needles. How often should you change needles, even if you think they're clean and they're not blunt yet?
Yeah, it's a really good question. I would say change them as regularly as possible. I think if we looked at, say, the numb nuts product, and I think we want to be changing, you know, our needles there, you know, probably, you know, at the 100 mark, or maybe a little bit more. But realistically, we want to be changing it. Like if you wanted a rough benchmark, yeah, 100 would be great. But I suppose for me, I think about if that's not really going into that subcutaneous space or under the skin really easily, then, you know, we really should just be changing them. You know, because the thing about how I think about all these things is what's the, you know, benefit to bother or the risk to reward. You know, needles are so cheap. So why, you know, scrimp out on a couple of needles? I think use them and change them as much as possible.
Tim, why do you recommend wet and drying at marking rather than doing it at weaning?
Good question. And that's all because it's so much easier at lamb marking to assess that udder. You know, because that's what we're trying to do. We're trying to see, well, you know, what does that udder look like? Who's actually got a lamb and who's kind of had some kind of udder development but doesn't have a lamb anymore? By weaning, I suppose the risk is that we can really we could penalise some ewes who maybe were some of the first ones to lamb, because their udder will be so small by weaning process, and that's the last thing we want to do is you know, remember we've got the top 25% and bottom 25%. We definitely don't want you know, those girls who are making the high tackle count or shooting, you know, if we want a netball analogy, shooting the most goals, we definitely don't want to penalise them. So that's why I'd recommend it, lamb marking.
Tim, I've got a question that's come through about the viscosity of buccal G6. Sometimes they find it doesn't recharge within the applicator properly. Do you think this has got something maybe to do with temperature on the product?
Yeah, I have heard that. I think where you put your bottle will have a fair bit to do with it. So my response to people who've got a bit of challenge getting that recharge is to keep that bottle at height, because that way gravity can kind of help you along with that for sure.
Oh, that's good practical advice. And the last question I have is, you mentioned before when we were talking about information that you should take to your vets when looking at pain relief. Why is sex of the lamb important when you're selecting the type of pain relief you're going for? Do you need to give more for ewes rather than ram lambs?
It's probably more just to have a think about, well, what options am I going to do? Am I doing surgical castration or rings? Because that'll just give us an idea. The sex of the lambs, if you could roughly, you know, line it up, it just sets up, are we using rings or not? And that's why I say the sex is important, but also it's really about the volume. Now, for analgesics, it doesn't really matter. We don't need to give more for more surgical procedures. I did have someone ask about double dosing Metacam. We don't need to, because remember, we're giving it systemically, so it acts on all sites of inflammation. And that's the great thing about all the analgesics, is that, you know, one application in the gums for buccal-gesic or Metacam acts on all those sorts of inflammation. So it's just a probably idea about getting a volume and, you know, trying to work out a costing strategy and a solution strategy that's best for producers, depending on what they're doing.